Hi, my name is Shirley Kutkowski. I'm here to talk to you today about dental hygiene and what is a dental hygienist and the limitations of dental hygienists, because I don't think very many people know about that kind of thing and why it's important for you to know. For instance, a dental hygienist cannot work without being kind of attached to a dentist. So what does that mean exactly? It means that if, let's say, the dentist is on vacation, or the dentist, or in a field, let's say, where the dentist doesn't want to necessarily work, let's say in a long-term care facility, a dental hygienist cannot be employed to work there unless there's a dentist at least who comes through once a year to evaluate the patient. So really, a dental hygienist cannot even just brush the teeth of your mother if your mother's in a long-term care facility. So that's a really big hurdle for most places. And I'm not saying that dental hygienists need to have independent kind of a practice so that they shouldn't be attached to a dentist, but there should be some kind of a stipulation where a dental hygienist can be employed at a long-term care facility even if there's no dentist present. Today, a dental hygienist would have to give up her license in order to brush the teeth of people in a long-term care facility, and then the patient still wouldn't have any real dental hygiene care. They would just have better oral hygiene as a whole, which wouldn't be bad because the expense attached to not cleaning teeth is really immense. For instance, oral hygiene care improvements have shown to decrease the amount of pneumonia by 24% in long-term care facilities. Now, if you think about how many people are in a care facility and that each bout of pneumonia costs $15,000 whether the resident of that facility dies or not, that's a lot of money. That's a real lot of money. CNAs, nursing assistants, just are not prepared to do the kind of thing that a dental hygienist is prepared to do. And it's really important that everyone start to really understand how this whole thing pans out. So that's one example. I know that there are children in the United States right now in hospitals whose teeth have given them either a septic condition where their entire bloodstream is filled with bacteria, or they have had an upper tooth gone bad and it has infected their brain. Across this country right now, I don't know exactly how many, but I do know that there is happening everywhere. For some reason, nobody calls the newspapers when these kinds of things happen, so it's not very much in the news. And when the news does come out, it's usually about how a dentist didn't have the wherewithal or the compassion to take the tooth out or put a filling in, when really that could have been avoided in a lot of cases by a dental hygienist providing dental hygiene care. But of course, unless there's a dentist involved, a dental hygienist cannot access that person, that child or that elderly person with the potential for problems. So I would like for you to take a few minutes and look at the practice acts of dental hygienists in your state and find out what the limitations are of a dental hygienist and see if it makes sense to you. My name is Shirley Gutkowski. If you have any questions, I'm easy enough to find. Shirley Gutkowski, Gutkowski. Have a great week.